Hi, my name is Angel. Let us discuss foot and ankle injuries in ballet dancers, right? So let's find out what ballet dancing is. An artistic dance form based on an elaborate formal technique characterized by gestures and movements of grace, precision, and fluidity. A theatrical presentation of ballet dancing performed to music and presenting a story idea or mood, usually with costumes and scenery. So, who is a ballet dancer? A ballet dancer is a person who practices the art of classical ballet. Both females and males can practice ballet. They rely on years of extensive training and proper technique to become a part of a professional ballet company. Ballet dancers are at a high risk of injury due to demanding technique of ballet, right? So as you can see, the hand gestures, extensions, the plantar flexion. As you can see, this foot, is all the way up in the high. Somewhere I do feel that the precision, the fluidity comes at a cost of a lot of foot injuries. Let's find out. So, what kind of foot and ankle injuries are found in ballet dancers? What do they suffer from? The repeated pressure and stress placed on your foot during ballet leads to stress fractures, which are very common. Jumping and landing is a large part of ballet, right? Which also puts excess stress on your feet and especially on your toes. This is especially true when dancing on point, right? So, this is actually dancing on points. Your plantar flexion, right? So you're tippy toeing, and these fractures are sometimes referred to as dancer's fractures. All right. So let's find out what the dancer's fracture is, also known as the fifth metatarsal fracture, as you can see in the X-ray. The fifth metatarsal fracture. This injury is often caused by landing awkwardly or twisting the ankle. A dancer's fracture is a break in the fifth metatarsal, the bone at the base of the little toe that's often caused by a twisting injury to the foot or ankle. It's a common injury for high performance athletes, but it can happen to anyone. Symptoms of a dancer's fractures include pain, swelling, bruising along the outside of the foot, difficulty walking, inability to bear weight on the foot, feeling or hearing a pop, right? So you can actually hear whenever you're walking, there's a pop on your feet, right? So you'll feel like something's not in the right place. Most dancers fracture are treated without surgery and can heal in 8 to 12 weeks. However, you have to be very careful. You have to rest, until it heals. Wearing a special shoe, boot, or a cast, following your doctor's instruction about how much weight to put on your foot, applying ice packs or an ice massage to reduce inflammation and pain. So ice pack and ice massage would help. However, it depends on how severe the condition is. If the condition is really severe, then chances are you will have to get a surgery. So let's find out what a lateral ankle sprain is. Is also one of the common injuries for ballet dancers. A lateral ankle sprain is a tear or stretch in the ligaments on the outside of the ankle. It's the most common type of ankle sprain and usually occurs when the foot rolls inward or inwards onto the ankle. Symptoms include pain on the outside of the ankle, swelling, especially overnight, bruising, difficulty putting weight on the foot, stiffness, especially after resting. Risk factors for lateral ankle include weak ankle muscles, high arches, poor balance, wearing shoes that don't fit well, and participating in certain sports, right? So if you're participating in certain sport where you have a lot of stress on your ankles, then chances are you will have some kind of sprain, right? As you can see, this is where you have a torn anterior talofibular ligament, right? So somewhere you will have certain type of ankle fracture right here. As you can see, this is a part of torn calcaneofibular ligaments. You have torn ligaments. That's the ankle sprain. The severity of lateral ankle sprain is graded as follows. Grade 1 is mild with minimal tearing of the ligament fibers. Grade 2 is moderate but significant tearing of ligament fibers. Grade 3, severe with complete rupture of ligament fibers, right? So this is grade 1, and grade 2 injuries right here. Treatments of lateral ankle sprains include early weight bearing as tolerated, removable plastic device like walking boot or air cast brace for grade 2 sprains, a short leg cast or a cast brace for grade 3 sprains. What is a stress fracture? Stress fractures are common foot injury for ballet dancers, especially at the base of the second metatarsal, right? So it's very common for the base of the second metatarsal bone. They occur when repeated stress or abnormal forces are placed on the bone, which can happen during repetitive jumping and running of ballet routines. Right? Causes and risk factors include overtraining. So let's say you're overtraining, you're dancing a lot, so that can be a risk factor. Poor nutrition can be a risk factor. Many people don't eat good quality food. They may survive on junk food. That may cause issues. Delayed menarche, okay. Flat feet or high arches can also be a concern. If you have a flat feet or you have a really high arch, that can be a cause for stress factor. Wearing shoes that don't fit properly, dancing for long periods of time, right? So either or can be a concern. Symptoms are pain in the midfoot that starts slowly and becomes chronic. Diagnosis can be difficult because there may be minimal swelling and pain is not always well defined, right? Treatment depends on the dancer's risk factors and may include a walking cast, wooden shoe removable brace, or taping. Taping can help a lot too, but that can also create a lot of issues, fungal infections, etc. So be careful with stress factors. Prevention, use proper technique. You have to wear very good quality, well-fitted shoes. Avoid dancing on poor quality floors. So for example, you have uneven floors or you have floors that are made of concrete and you have to constantly jump on them. That is not advisable. If you have a floor that is fully padded, that can help, but if it's like concrete hardwood floor, it would be very difficult. Maintain good overall health. Wear orthotics to control foot mechanics, right? When not dancing, balance the length and strength of the foot muscles. You have to balance the length and the strength of the foot muscles. 3 to 4 layers of muscles. You just have to balance them. You have to get them ready to act as pad in case if there is any shocking movement, let's say landing on your feet or landing on your toes, right? So be careful. As you can see, this is the x-ray. This is the calcaneal bone. You can actually see a stress fracture here. You can see a stress fracture here. You can also see a stress fracture here, right? You can see a stress fracture on the tibia, right? What is Achilles tendonitis? So Achilles tendonitis is also one of the common injuries for ballet dancers. What are the causes? As you can see, this is tendonitis. Inflammation of Achilles tendon. This is a heel bone. As you can clearly see, there's a tear in the heel bone, right? Causes repetitive stress for jumps, landings, and being end point. Ballet dancers usually stay on point a lot, right? They're tippy-toeing. Can irritate the Achilles tendon. A sudden increase in training volume, such as returning to on point after a break, then flooring your dancing on. Poor habits, such as not putting your heels down during jumps. Symptoms can be pain when touching or squeezing the Achilles tendon, or pain when rising onto demi-point or pointy. Treatment, rest, ice, adhesive straping, anti-inflammatory drugs, local injections, thermotherapy, laser therapy, manual therapy, functional exercise program. These are all the treatments. However, the best treatment would be resting and also let's say functional exercise program where physiotherapy can help you, right? What is the recovery time? It can take at least 4 to 6 weeks of conservative treatment for a complete recovery. Even after the pain subsides, it is recommended to slowly return to activities, as you can slowly return to activities, but the best part to do would be at least to take stress and or go for physiotherapy treatment. To prevent Achilles tendonitis, you can try to warm up before class and avoid dancing on a cold tendon. Alright, so avoid dancing on a cold tendon. Blisters and calluses. Calluses, a natural defense against blisters. Calluses protect your feet when dancing barefoot or on point, or or in pointy shoes, right? So ballet dancers usually wear pointy shoes like these. They're tied, in front of their toes. Removing them can make your feet too tender to dance in. Blisters can be caused by several things, including new pointy shoes, sweaty feet, or choreography that requires more movement. To treat a blister, you can soak in Epsom salt. Warm water and Epsom salts can reduce swelling and heal the skin. Drain the fluid if you need to keep dancing. You can lance the blister with a sterile needle to relieve pain. Only do this if the fluid is clear, right? So you can drain the fluid. Just make sure a podiatrist is the one who's doing it and not you. Use foot powder. Foot powder can help prevent blisters by keeping your feet dry and reducing friction. Moisturize. Regularly moisturize the areas of your feet that are prone to blisters, calluses, and corns. You can apply moisture before bed and cover your feet with socks. Okay, so what is a cuboid syndrome? A cuboid syndrome occurs when the cuboid bone, as you can see, this is the cuboid bone, in the foot shifts out of the place, causing pain and discomfort. It can also be called subluxated cuboid, dropped cuboid, or cuboid fall syndrome, right? Because it's dropping out, it's getting dislocated. So what are the symptoms? Pain on the outside of the foot, especially under the pinky toe, is the most common symptom. Redness around the injured area. Difficulty moving or twisting the ankle. Limping, weakness in the foot, and pain that worsens in the morning and improves throughout the day. Causes are cuboid syndrome can be caused by trauma or repetitive movements such as those used in ballet. It can also be related to other medical conditions such as flat feet or overpronation. All right, so it can also be caused by flat feet or overpronation. What is the treatment? Treatment for cuboid syndrome involves manual reduction of the bone by a therapist or a physician, followed by taping and orthotics. Anti-inflammatory medication, rest, and heat packs may also help. Recovery typically takes a couple of months depending on the severity of the injury. Many patients can return to their normal activities after healing process is complete. So patients can actually return back to their normal healing process, okay? So they can actually, but provided they take enough rest and they do get the treatment, they follow the therapist or physician's advice, and also use taping and orthotics, okay? So what is Helix Rigidus or limitus, right? Ballet dancers can develop Helix Rigidus or Helix limitus. Conditions that cause pain and limit movement in the big toe. Helix limitus, right? Helix is a big toe. Limitus, that means your big toe is limited. An early stage of condition where the big toe joint is stiff and painful, but there is still some flexibility. Dancing on point can cause helix. As you can see, dancing on point is the main reason why it's causing a lot of injuries, because that kind of messes up the biomechanics of the foot. And humans are not supposed to tippy toe as adults, right? Humans are not supposed to do that. There's a reason why we have a heel pad, we have plantar, all those part of our feet kind of helps us stand straight, and this is exactly why we don't drop. Try walking on your tippy toes for longer than 5 minutes, and I promise you it will hurt you real bad. So ballet dancers is what they not only take so many movements, but they also land on their tippy toes. Now that's really dangerous, right? So dancing on point can cause Helix rigidus because it requires a metatarsal phalangeal joint to make a 90 degree. Alright, so to make a 90 degree angle, dancers who start later in life may not have enough mobility to do this, which can lead to impingement, spurs, and decreased motion. To prevent foot problems, dancers should get their shoes fitted often, warm up and stretch properly, and monitor their posture and movements. If you have foot pain, you should seek proper therapy to avoid worsening the pain or developing more serious injuries. Treatment options include using a dancer's pad in your shoes to decrease pain and improve range of motion, taping the helix, your big toe, modifying your shoes to stiffen the sole, doing exercises to increase dorsiflexion. All right, and the last would be surgery if it gets really, really bad. So as you can see here, you can actually see there is some sort of limitation where you can actually feel that there is a little bit of stiffness, as you can see right here. And it's happening on both the toes. It's not just one. So you know we have a problem. Okay, so what is sesamoiditis? Sesamoiditis is a common foot condition for ballet dancers that causes pain and inflammation in the ball of the foot. This particular area is the ball of the foot, directly under the big toe joint. So this is the big toe joint, and this is the ball of the foot. What are the causes? Repetitive stress or overuse, especially from the activities that put a lot of weight on the balls of the feet, like dancing, running, or baseball catching. They're all causing a lot of weight on your balls, right? Balls of the feet. What are the symptoms? Sharp pain under the big toe joint is a symptom. What is the treatment? Rest, anti-inflammatory medication, and sometimes the dancer is bad if left untreated. Sesamoiditis can lead to sesamoid bone fractures. To treat sesamoiditis, you can try resting your feet. Yes, you can rest it. You can also try relieving pressure on the sesamoid bones, can help reduce the pain. Using a dancer's pad, you can actually adhere a 1/4 inch thick flat felt pad to the ball of your foot to protect the sesamoids. You can also incorporate the pad into a custom orthotic or adhere it to the bottom of your insole. You can also change your nutrition. You can take calcium and vitamin D. Your doctor may recommend taking 1500 milligrams of calcium daily and getting a bone density screen and vitamin D25 level check. All right, eating a healthy diet. So try to eat a balanced diet. So you don't have less of something or more of something, sesamoiditis can also be very common, with those that may suffer from obesity. All right, so thank you for watching. I hope this video helps. If you're a ballet dancer, just make sure you're doing the right exercises. Warm-up exercises helps a lot. So if you're a ballet dancer, do warm up and make sure that even if you're wearing your on pointe ballet shoes, just make sure they're well padded, and try to give your feet much relaxation and rest, let's say, while you're not dancing. So don't go ahead and overexert yourself while you're doing ballet dance. Right? Thank you.